many of us with migraine know that it can be easier to attempt to prevent an attack before it happens rather than tame it once it has arrived. What type of options exist to try to prevent migraine attacks without medications?
Again, a lot of people are looking for all those non-drug options, and definitely in prevention, there are multiple things that you can do to raise your threshold so that it's less likely that you're going to have a migraine attack. Some of those are lifestyle changes or management that you can do. I like to tell my patients about planting the seeds for success in migraine management. So SEEDS stands for sleep regimen or sleep consistency, eating regular healthy meals, exercising daily, avoiding dehydration, and then stress management, not stress reduction. We all have stress, difficult to control, but we can manage the way that we respond to stress. Those are some of the non-medication options that are available. There's also behavioral therapy, such as cognitive behavioral therapy, biofeedback, that are evidence-based preventive treatment options for migraine. And then some of those devices can be helpful for prevention in addition to being helpful for acute treatment. The devices that are FDA cleared right now for the prevention of migraine include the Cephally device, the gammaCore, and the Savvy Dual. Another non-drug option for the prevention of migraine are supplements, including magnesium, coenzyme Q10, or even vitamin B2 or riboflavin. These can be effective for migraine prevention. Those are most of the non-medication options that we have to raise that threshold so that it's less likely that someone has a migraine attack.
What about available medications, prescriptions in the prevention of migraine attacks?
We actually have quite a large toolbox of migraine preventive options, and we're continuously working to develop more as well. But currently, we have non-migraine specific preventive options, and then we have migraine specific preventive options. So the ones that are non-migraine specific are medications that were designed for other disease states. However, in clinical trials, we found that they were effective at reducing the frequency of migraine attacks. These medications include oral medications that are antidepressants, like amitriptyline or nortriptyline, oral medications that are anti-seizure medications, like topiramate or valproic acid, and then also blood pressure medications, like propranolol or candesartan. And these medications can be very effective at reducing the frequency of migraine attacks. There are some newer therapies that are now migraine specific. They were designed based on what we know is happening in the brain in migraine. These medications are targeting a protein called CGRP. CGRP is very active during migraine attacks. So medications that can reduce CGRP activity can be effective at preventing migraine. There are CGRP monoclonal antibodies. These are injection medications or infusion medications that are administered once a month or once every 3 months for an individual. There's also gepants that are effective not only for the as-needed treatment of migraine, but that class is now also effective for the prevention of migraine. Rimegepant or Nurtec, which can be used as needed for a migraine attack, can also be used for prevention when used every other day. And then another medication, atogepant or Qulipta, taken daily can be effective to reduce the frequency of migraine attacks.
So, to summarize a number of the different things that you've covered here in the topic of prevention in migraine management, you've covered medications, devices, lifestyle factors, behavioral therapies, and nutritional supplements. Should everyone have a prevention plan, or how do you know if you can benefit from a migraine preventive plan?
I love the way that you asked that question because I do agree with you that everyone with migraine can use some of those preventive measures. Those lifestyle factors and supplements can be used by everyone who has migraine. However, more focused preventive therapy and those prescription preventive therapies should be recommended for individuals who are having frequent attacks. So individuals that are having 4 or more migraine attacks per month or more than 1 migraine attack per week, should consider prevention. If their acute or as-needed medications are not effective or poorly tolerated, they should consider prevention so we can stop the attack before it even happens. And then for people where migraine is adding burden and impairing day-to-day function, consider migraine prevention. Because it's important to remember that migraine preventive treatment options not only reduce the frequency of attacks, but they also shorten the duration and reduce the severity of the individual attacks, so that the individual attacks are now more amenable to those acute treatment options. So consider prevention if you feel that you are in these types of categories. Speak with your healthcare provider, your headache specialist to find the right option for you.